say you love me, but I don't think that it's true. It's all for you.
Hi guys, welcome back to my channel. My name is Linda. I'm a registered general nurse. If you have not already, please do subscribe to my channel, and if you have, thank you. And if you are new to my channel, please consider subscribing, and don't forget to smash that notification button so that you do not miss any update from me. So guys, it's been red hot, and so your girl decided to go out for a little ride. And it's, as you all know, that baby is on the way and I'm all packed up for labor. And so I want you to stay tuned, or no, come with me whilst I show you what is in my hospital bag. What do you need in your hospital bag? I'll see you in a bit. Hi guys, welcome back and thanks for joining me. Right, so I am going to go through with you all, show you what is in my hospital bag using the NHS hospital bag checklist. I'm going to use the Hull University Teaching Hospital checklist, which is more detailed. You can start packing whenever you want, but it is a good idea to get your bag ready at least 3 weeks before your due date. And I believe that I've packed enough for my baby and myself, because you never know what will happen. Doctors may ask you to stay for a couple more days to monitor your baby. So I always say just pack enough, because I've seen the frustrations of patients who come to the hospital thinking that their condition is a day case, and they ended up having to stay a couple more days, and they were so frustrated. They were not happy at all because they had not brought anything with them. So I don't want to go through that frustration and that stressful moment. No, I just want to avoid all that. So it is always a good idea to pack enough and not overpack. Right guys, and also I know that some moms enjoy their stay in hospital, whilst others, it's stressful for them. So and for that they just can't wait to get home. But if anything being equal, if your baby and yourself are doing well, then usually you should be ready to go home between 6 and 12 hours after birth. However, you may be asked to stay a couple more days if yourself and your baby need extra care. So as I say, pack enough. I know people do overpack, and they pack all sorts of things that are not needed, right? But if you have no idea, if you are clueless, don't worry. Your midwife is the best person to steer you in the right direction. So ask your midwife what you need to pack if you are unsure what to pack in your hospital bag. Right, so let's crack on using NHS checklist. Right, so I'll do mom first. I'll do my first before baby. Right, okay. Right, so going home clothes, a loose comfortable outfit. So I've got myself, right, got myself a loose outfit. It's very comfortable because it's still summer and it's very warm. I've got myself this one just to go home with them. And then the second one says nursing bras. So I've got 2 nursing bras from Amazon. I think my husband is been messing up with my stuff. Right, so I've got 2 nursing bras. I don't know where the other one is. I've got 2 nursing bras. They are so comfortable. They are not that expensive. Yeah, so just unclamp this one, and then you can start feeding your baby. No stress at all. And then let's see the next one. Next one says breast pads. So I've got a couple of breast pads here. As I said, hopefully I don't stay in for too long, but I've got a couple of them here. Yes, and maternity pads, right? So I've got these maternity pads, got 2 of them. Got these ones. I read the reviews and apparently they are very absorbent. I got them from Amazon and they are organic. I prefer organic stuff. Yeah, so you could try that one if you want. I've got 2 of them here. And then disposable pans. I've got a couple of them. I've got 1, 2, 3, 4, 5 of them. 5 of these knickers. I got them from Amazon. They are super comfortable. Really, they are not disposable. You can still use them, but if you want, it's up to you. You can just chuck them away after using them. They're really comfortable. They are on Amazon. It comes with different colors and it's super comfortable, as I said. Open fronted 90, suitable for breastfeeding. I've got myself, because it's too hot, because we're still in summer and it's getting hotter and hotter. Well, if I am at home, I'll prefer not to wear anything when I'm sleeping, but you know, yeah. So I've got myself this one, which is cute and very light, very breathable. So you just open in the front bottoms and then start feeding your little one, which is really nice. Yeah, I love the color, summer colors. Yes, I've got that one. And then it says plastic bags to put dirty clothes into. Plus, I think I've got a couple of plastic bags. I'm not sure where I've put them. Yeah, I have, but I don't know where I've put them. Yeah, so that's the other color, that breastfeeding bra. Yes, I've only got 2 of them, which is enough. So it's a toiletries. I've got all my toiletries here. I've got yeah, everything. My sponge. I've got my shower cap. I've got my deodorant. Everything. I've got everything in here. Got my my toothpaste. I've got my soap. I've got my brush. I've got everything in there. I've got my comb. I've got everything in here, right? Right. So Bev preference plan and maternity notes. So I've got my maternity notes here because they will need it. The doctors will need to read everything if there's a plan in your, well, so far if you've done a plan with your midwife, then they would want to go through and then follow the plan, because they need to respect your medical plan. Several night dresses or t-shirts, right? I've got a couple of them. I've got t-shirts. These are also quite comfortable, breathable, because it's still red hot. I've got all these, yeah, to go with me. Slippers. So I've got my slippers here. Yeah, just I want everything comfortable, you know. These are super comfortable to walk in and just walk around the world and wherever you want to go, and it's very comfortable, as I said. Socks. I know it's still summertime. I know I'm not going to wear these socks, but I'll just put them in. Where is the other one? Yeah, I put some socks in, but I know very well that I'm not going to have them because it's red hot. It's ridiculous. I'm not going to wear all these socks. No, not me. But I've put them in just in case. Lip balm. Oh yes, I've got my lip balm here. Yeah, because your lips can get very dry and start cracking. So I've got my lip balm here, which is cocoa butter, Palmer's, which is really good. I've been using it for a long time. You can get it anywhere in any shop. I mean, water spray or sponge or fan to keep you cool, because yes, you really need it, because as I said, it's still summertime and it's just ridiculous. I have got my little friend here to cool me down. Yeah, so you really need one. You need it, love. Yeah, and then the next one is prescribed medication you may have. Right, so I'm not on any medication, but because I will be breastfeeding, I have still got to take my vitamins with me. So I've got my vitamins. I'm taking my vitamins with me. Loose change for car parking. Yeah, I've got a couple of coins. Oh, I've got money for that, don't worry. Thank you. Pillow or fleecy blanket, 2-1 for that. With pillow, I wouldn't want to bring any infections home, so I'd rather use, I might take some pillowcases, but I'll use the hospital one. I'm not taking any blanket, 2-1 for that. Bev ball, but it says here, but it is provided on the ward. You don't necessarily need to take a Bev ball to the hospital. They've got one if you need it. Books, magazines, whatever. Tablet. Well, so I've got my tablet here, and then I've got a book here just to, you know, keep you a bit entertained, because it can be very boring when you're in the hospital. I tell you, it's not a nice place to be. I know, but at least just get something to engage yourself with, and that will make the time go faster. Tissues or wet wipes. Tissues, I've got a couple of tissues here, got a couple of them in there, and then I've got some wet wipes. Yes, mobile phone. Yeah, I know, everyone knows. Yeah, we all know that we have to take our mobile phones. Charger. Yeah, I've got my charger. Yeah, so these are all you need for your hospital bag. Right, it doesn't say on it, but on the general NHS website, it says snacks or drinks. I know here it doesn't say it, but I've got some snacks. I've got, yeah, things to keep me going after bed. So I've just got a couple of drinks and a couple of snacks. Yes, I have. I've still got some stuff in my bag which are not on the list, but I'm going to, which are, right, let's see. So nappy cream. I know people do take nappy cream to the hospital. It's also barrier cream, just to prevent sores, and because baby will be weird and pooing all the time, so you need to apply some barrier cream to stop any sores or any redness or whatever. Well, it's up to you. It's not on the list, but it's up to you. If you want to take it, that's fine. And then I've got a thank you card. It's not on the list. As I said, I've got some stuff that are not on the list, but I have got them. I've got a little thank you card for the staff. It's just to say I do appreciate their effort, because I know how it feels like. It's quite stressful. It's always short. I mean, we all trying our best to make an improvement, but it's not easy. Sometimes people make nurses and other staff work more difficult than it is already, and so the least you can say to them is thank you, and that goes a long way. So just get a little card and say thank you. I've got a nursing pillow. It's not on the list. I've got one. It's not on the list, but at least it helps to support baby when breastfeeding. I've got my diary. It's up to you. You don't have to take it with you, but I have got my diary because I love to write things. You know, what happened, if I need to do any reflection, whatever. Yeah, so I've got my diary to write everything yeah, that needs writing. And then I've got Peri bottle and Peri spray. I've got this one, Peri bottle. Right. So this is the Peri bottle. So the perineum is the area between your genitals and your anus, and during childbirth, this fleshy area can strain as you bear down and push out baby, and this may lead to tears. And because of the laceration, when you are using the toilet, it can be very, very painful. So you need some cooling measures. So you need a little water bottle, you know, to kind of like wash your down below after toilet, because as I say, it can be very, very painful. And then also I've got that Peri spray. It's got antibacterial properties, which is very, very good. It's called My Expert Midwife. I got that from Amazon, just to ease all the discomfort. It's up to you. You don't have to buy them, but I have bought them because I don't want to, you know, like, I prefer to avoid all the pain and the discomfort than, you know what I mean. Yeah, so just I got these just to yeah. And then I've got some mint. Yeah, just, you know, like, keep the day going. And yeah, I've got a couple of mints here. Yeah, and then I've got the nipple cream. Oh no, I've got a nipple cream, yeah. Right, so with the nipple cream, I don't think, taking it to hospital, I don't think it's necessary, because, you know, if you position your baby very well, and they are latching in the right position, your nipple shouldn't feel sore. Yeah, so it's up to you. As I said, you don't necessarily have to buy them, but sometimes you buy them and you never use them. It's up to you. And then I've got my towels. I've got 2 towels. Should be okay. Hopefully I don't, you know. And also here on the list it says, let me double check. It's a morning gown. Yeah. So I've got myself this morning gown. It might look heavy, but it's very, very light. It's very comfortable. It's not as heavy as you see it. Very, very light and very comfortable. And I've got my water bottle. It's not on the list, but you know that you'll be drinking more water. You need to hydrate after all this, you know, like, it's like running a marathon. So you need some water to keep hydrated and also to keep going. So I've got my water bottle. I got it from Amazon. And then I've got this just to put, well, because apparently they say you can get very constipated after having a baby. So just get yourself some fiber, anything fiber. So I've just said, oh, I'll put some banana. I'll put a couple of banana in and then have them right after. So I think, yes, I think that's all I have for my side. And so we're going to go for babies. So for your baby, we've got on the list baby clothes. So vest, sleep suits, cardigans, and a hat and mittens. Yeah, right. So I've got some vests. I've got a couple of them. Got a couple of vests here. Got about 1, 2, 3, 4, 5. As I always say that I hope that they don't keep us in for too long. Got baby clothes here. Got about 1, 2, 3, 4, 5. So I'll pack enough just in case we need to stay in for a couple more days. I've got a couple of mittens here. Yeah, put them here because they are too small. They get missing in the bag, so I've just put them in this pouch. Yeah. Socks. I've got a couple of socks here as well. Got a couple of them. I know I don't know whether I'll use them. As I said, it's too warm, but babies are different from us, isn't it? So yeah. Cardigans. Let me see. Cardigans. Cardigans. Where are the cardigans? As I'm saying, it's still too warm. I don't know. As I'm saying that, you know, babies, they can't regulate their temperature, so yeah, they might need them. Even though it's summer, it's very warm, but they might still need them. So I've got about 3 cardigans. Yeah, 3 cardigans. I think it's enough. What else? Muslins, babes. Yeah, so I've got about, how many muslins have I got? I've got 1, 2, 3. I've got 3 of them here in my bag, which I think it should be enough. Yeah, baby blanket or shawl for when going home. I've got 1 blanket here. Yeah, so when baby's coming home with me, just wrap around in the blanket. Nappies and wipes. I've got a couple of nappies here. Got them in this pouch. Got a couple of them. Yeah, it should be enough. I've got about 15 or 20, can't remember, but I've got enough here. Yes. Car seat. So I've got my car seat. Well, I've got baby, not my car seat. Right. I've got baby car seat here. Right, to bring my little one home. Yes. Because if you don't take one, I don't think they'll allow you to bring your baby home. Yeah, so I've got a car seat here to bring baby home. What else? Right, so it says if you have made an informed decision to formula feed your baby, you need to bring into hospital ready-made first infant milk. Right, so I have got this one, this one, but I am going to breastfeed. I'm not going to do formula feed. I might introduce formula feed at a point, but I am going to do a straight breastfeeding. But I've heard some moms say that after birth they were struggling to produce breast milk. Nothing was coming out, so they had to give this first, and then once they start producing, then they carry on with breastfeeding. Already I've started leaking, so it's a good sign. So hopefully I don't use this because I don't like it anyways. Yeah, so just in case, but I know that I'm going to have enough breast milk to feed my baby, which I said I've started leaking, so hopefully. And I've got some babes here. I've got some babe clothes here. Got two of them. I've got some babes, a couple of them. Yeah. And then hat to keep baby warm. I've got about 3 hats here, and then I've got a headband, and then bonnet here for baby. Yeah, and then yes, and then home clothes for baby. I've got this one for baby to come home with. Yes. Right, yeah, so I've got some wipes here. I've got 2 wipes here. I think I've shown you the nappies already. Yes. And then I've got some 2 baby towels here. They are not on the list, but I think it's common sense, isn't it? Yes, I've got 2 of them here. And then I've got about 1, 2, 3, 4 flannels. They are not on the list, but I just thought, let me take with me. Yeah. So that is what you need to take according to the NHS recommendation for babies. I've got a dummy. It's not on the list. I've got a dummy here, which it doesn't say dummy on the list, because it is a good idea not to start this until breastfeeding is established, which is around 1 month. So it is advisable not to start them with this, start giving this in the first couple of weeks until about a month when you establish breastfeeding. And I've got 2 bottles, right? I've got 2 bottles with me, feeding bottles. If you are not going to breastfeed, if you're going to formula feed, then you need the bottles. But I don't need the bottles. I'm not taking them. I've just put them in just to explain things to you guys. That if you're going to, I know people do pack up, even though they're going to breastfeed, but they still pack bottles. I am not going to formula feed. I'm going to breastfeed. So I don't need the bottles. I don't need to take bottles. But if you are going to formula feed, then you need to take some bottles. But it needs to be sterile. Yeah. So all these are not on the list. And then I've got sterilizer here. I've got this little cute sterilizer which I bought from Amazon. It comes with a little dummy. Yeah, so as I said, you don't necessarily need to take dummies, because it can get in the way of breastfeeding. But the reason why I bought this is that, you know, sometimes once I start giving her the dummy or teat, sometimes when you drop it, I know some mothers will just lick it, right, in a way of cleaning it and then put it back in bed, which is totally wrong, right? The only time you can do that is when baby is around 12 months. By that time they had built their immune system enough. So yeah, so all you do is just get a little sterilizer, take with you wherever. So when you drop it, get a bit of water. Know that you always have some water. You just wash it and then sterilize it before you put it back in baby's mouth. Yes. And then I've also got nappy bags, which I think is not on the list, but I think you should take some nappy bags. I've got baby set. It doesn't say on the list as well, but you know, you comb your baby's hair after a bath. I've got brush. I've got everything, thermometer, everything. Scissors. I've got a little teddy bear toy here just to play with baby. It's not on the list as well, but I've got it just to play with baby. Yeah. And then I've got sanitizer. You need to make sure that your hands are free of germs before touching baby and doing any tasks relating to baby. So it's very, very, very important. And on the list it says cotton wool. So I've got my cotton wool here. And I've got this little sponge for, I don't know when I'm going to use it. Very soft, just wash baby. Yes. And then I've got, I think the last one, I've got this one, which is also not, I've got a couple of them. Can't find where have I put all this. Yeah, I've got some books, storybooks, nighttime storybooks. Yeah, so I've got a couple of them here to take to the hospital. I've got baby foot muff. Yeah, I can take that one off. I can take this off. Oh, come out, come on. Just bear with me. Right, yes. So I'm going to use this as a liner in her car seat. So I'm only going to use that one and not this one to cover her up, because it's too warm for that. Even the blanket, I'm not sure what I'll use the blanket, but just take it anyways. And yeah, I think that's all for babies, guys. So yeah, so I know by this time you have an idea what you need to pack. And as I said, if you're unsure, just ask your midwife what you need to pack. Just pack enough just in case. We all pray and hope for a safe delivery. Right, guys, so thank you so much for staying with me till this time. I know it's been so tiring. Even talking it's been so tiring for me. And I hope this video has helped a lot. Please don't forget to subscribe to my channel. So you can follow me on Instagram. On Instagram is evergreen.otin, and on Facebook is Linda Anoche Otin, and on YouTube is Linda Anoche's channel. Right, so until we meet again, it's bye.
You say you love me, but I don't think that